Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast.
Good afternoon, guys. Welcome to our weekly talk here at Akesis Holistic Health. This is Dr. Homer Lim, welcoming you again. So for today, we don't have a specific topic. We will actually be talking about we're going to be going over some questions that our followers have been asking here at our Facebook post. Okay, so let's start with these questions. Medyo they're a bit more than madami pala sila. Okay, so one question from Miss Chris Lane. Okay lang po ba mag-take vitamin D na 10,000 IU? Thank you. Okay, so actually taking vitamin D 5,000 to 10,000 IU, there was a research by done no in Europe wherein because alam niyo in Europe nga walang mga araw, so mahina ang amount of vitamin D that they are producing. So they do advise people taking vitamin D of up to 10,000 IU a day. Okay, so you may take vitamin D on 10,000 IU if you are kumbaga, if you're afraid that you might get over, but you can do a what we call a serum vitamin D levels if you're taking high doses of vitamin D just to check your vitamin D levels after taking a high number of vitamin D na 10,000 IU per day, no? But normally, in patients who have chronic diseases, no, mga autoimmune diseases, cancer, diabetes, nor those on dialysis, they usually have very low levels of vitamin D. Especially now, no, because of the tinatawag nating COVID, no, na a lot of people are actually deficient in vitamin D or mababa yung vitamin D nila even before magkasakit sila. So that's why madali sila magkasakit because mababa yung vitamin D levels nila. So I really hope that you either take vitamin D or you make sure na maarawan kayo. Okay? So next question from Miss Leah Balagtas. Naggagamot ba ang arterial peripheral disease? Yes, definitely. We have treatments for arterial peripheral disease. One of them is tinatawag natin IV laser. So we've done a couple of patients who had tinatawag natin peripheral arterial diseases. It helps, number one, no, relieve the pain. Number two, actually, baga after 10 to 20 sessions, they do start having good tawag natin maganda na yung circulation sa paa, no? Okay? From Depi Ilagas, no? Sabi niya, she's a multiple sclerosis patient. So, gusto ko malaman may paraan bang how to manage the inflammation and tamang vitamins. Okay. So, this is what we discussed earlier, no? Yung mga chronic diseases, chronic inflammatory, chronic degenerative diseases, one of which is actually multiple sclerosis, no? Vitamin D, as high as even 10 to 20,000 IU per day, no? In fact, you can go search, Miss Debbie, you can go search Coimbra protocol, where they're actually giving up to 200,000 IU a day. However, we don't recommend you taking that amount unless are under a supervision of a doctor kasi medyo mataas na pagka 200,000. You need to check your vitamin D levels as well as your parathyroid levels. Okay, so but yes, we can manage the inflammation. You can also take turmeric, okay, because that's also a very, very good, powerful anti-inflammatory agent. And of course, you have to avoid meat because meat is a pro-inflammatory. Okay, so another from Miss Junie Wong. What is the best to do if you have severe allergies, especially if the eyes are affected and some dermatologists have given up? Actually, if you have severe allergies, aside from tinatawag nating avoidance, we have to correct your gut, meaning we have to clean up your gut. Baka meron kang gut issues, madaming bad bacteria ang gut mo. At the same time, we can give some anti-inflammatory agent. Pero of course, easier said than done, but it can be relieved, can be managed properly, not just using what we call mga steroids. Kasi steroids, hindi naman yan long-term. We need a long-term solution. So one of that is really to clean the gut. Okay, so if you clean the gut, give you a nice, good probiotic, it will help at least relieve the symptoms, lessen the severe allergies, especially around the eyes. No? And then there's one from Kevin Perez. What's the root cause of hemorrhoids? At paano mawala? Okay. So, normally, yung hemorrhoids, no? So, these are yung blood vessels around your rectum, no? Kaya nandyan yung blood vessels is parang to help as your poop, no? Yung dumi natin, nagpa-pass through, no? Minsan talaga, lumalaki yung hemorrhoids, especially if you are tinatawag natin constipated, namamaga sila. So, hindi siya nawawala kasi it's part of your human anatomy, no? So, pero kung sobra na silang laki, namamaga na sila, walang choice to be, you either have to do a surgery, no? O surgery kasi kailangan tanggalin na yung hemorrhoids. So, hindi siya nawawala, lumalaki siya. Pwede natin paliitin, no? With some supplements and herbs, no? And six bath, tinatawag natin six bath, no? Pero, you cannot really make them disappear, no? You really have to do a surgery pag malala na siya, no? Okay, from Miss Olive Las Piñas, if the cancer, sabi niya, if the cancer has metastasized to the lungs, is it also likely to metastasize to the liver? So, and aside from bone scan, the skeletal survey could be a basis then. Okay, so Miss Olive, you're asking question, if it has metastasized to the lungs, yes, it may also be metastatic to the bone. But that happens a lot actually, no? So, sabi niya, aside from bone scan na hindi raw available sa provinces, skeletal survey would be a basis. Actually, pag skeletal survey, only if yung metastasis mo sa bone is malalaki na. So, pag maliliit yung metastasis, most of the time hindi rin nakikita sa skeletal survey. So, it's really best pa rin in bone scan versus a skeletal survey. Okay? So, next question, Chai is asking, for breast cancer, what is the treatment plan? Who just underwent mastectomy but who does not want to undergo chemo or radiation? ERPR positive, HER2 negative. So actually, we do advise consult with your oncologist after your surgery. It is a patient decision, no, whether you want to do chemotherapy or not, no. But for whether or not you're doing chemotherapy or not, we have a treatment plan where we use high doses of vitamin C. We also you can use what we call mistletoe. We have also B17. So these are some of the things that we do together with your very, very important is actually diet. We have to improve the diet for patients who had cancer, not just breast cancer. No? Okay. Next question from Claudine Santos. What's the best IV nutritional therapies that you can recommend and how do they prevent COVID infection? Okay, there's one vitamin, of course, the most well-known vitamin for virus, no, it's really vitamin C. In fact, in China, specifically in Shanghai, no, they are using high doses of vitamin C. Also in the United States, Dr. Paul Marik and Dr. Pierre Corey and Dr. Baron of the FLCCC, which uses what we call the IMAT protocol. They use high doses of vitamin C. So for whether to prevent or treat COVID, we do suggest you take the best that would be vitamin C with a bit of NAC or N-acetylcysteine, or I would prefer glutathione and a bit of zinc. No, we put zinc in the IV. No? So that's what we do for patients to avoid, to treat, as well as post-COVID. We also give vitamin C. No, okay. Next is Trinidad. Sa dami ng iniinom na vitamins to prevent COVID-19, how do we protect the liver and the kidney? Okay, very good question. I think that's one of the things. So, vitamin C in general does not affect the kidneys. Okay, number two, vitamin D does not affect the kidneys because it's not processed by the kidneys. No, it's a fat soluble vitamin, so it doesn't really have an effect on your kidneys. It might cause liver problems, but we have not seen anyone with vitamin issues with the liver, even if their vitamin D levels sa serum or sa blood is over 100 na. So we don't really see that. So, and then we have the zinc and the quercetin. So quercetin is a flavonoid. It's very good for COVID. It prevents COVID. It treats COVID. No, acts like hydroxychloroquine. And then you have zinc, a mineral. No, so these doesn't really affect the kidneys. What affect the kidneys if you're not drinking enough water or if you're not hydrated, then that becomes a problem, especially if you're taking lots of vitamin C kasi pwede ka mag-form ng what we call uric acid stones. No? It's not the vitamin causing the problem. It's because you're not drinking enough water, hindi ka dehydrated properly. With taking vitamin C, your body will try to excrete uric acid and oxalates. And so if you're not dehydrated properly, pwede ka rin magkaroon ng tinatawag natin stones. But that's very rare. No? So it's really important to drink lots of water. For the liver, of course, it's not really the vitamins. You also have to consider what you're taking as food. Number one cause of fatty liver, especially in Asia, is actually high carbohydrates. Okay, so if you eat lots of sweets, lots of bread, lots of rice, lots of pasta, soft drinks, juice, packed juices. So these are the things that are can cause you what we call fatty liver. So that's what we have to avoid, not really the vitamin for your, to boost your immune system. So I think that's medyo misplaced, no? Okay. Then next, Miss Kat Flores, she said that she watched the I Protect video 2.0. Okay. And then what to do with people with anxiety disorders prone to have COVID? Okay, she's asking what to do in patients with anxiety disorders who are prone to having COVID. Okay. So actually, number one, of course, we have to treat their anxiety disorder or manage their anxiety disorder because the reason she asked this question was one of the things that I did mention in a study funded by the US FDA. Now they found out that the top three causes of death in COVID patients are number one, obesity, number two, anxiety disorder, and number three, diabetes. So how do we, that, which is very true. We have a lot of patients with anxiety disorder without other comorbidities, no? And they do develop severe COVID. So it's really very important to treat patients with anxiety disorder. So the number one supplement I would always suggest would be L-theanine. No? L-theanine is a very good calming agent, no? From tea, L-theanine. So it's not a drug. It helps you calm down. It's called L-theanine. So that would help in patients with anxiety disorder. Okay. So another one from Sin Chan. What if instead of hydrogen peroxide, the blue one, which is bought, can it still be diluted 1 to 2 to get 1.5? Actually, the blue is diluted already. I think it's more diluted. I'm not sure of the numbers, but you still can use that as a gargle. Do not swallow as a gargle. Okay? Do not swallow hydrogen peroxide. You can use it as a gargle. You just have to dilute it to normal 1.5%. Further, more questions, no? It is from Trina Marquez de Cruz. Is high dose vitamin C okay with pregnant women? Why not? Still vitamin C. So there shouldn't be any issues with vitamin C, whether oral or IV. Okay? Miss Denny Comia, she's thalassemic. So she said, is there holistic procedures to manage beta thalassemia minor with non-transfusion dependent iron overload? Okay, so she's asking the question for her because a lot of people who have thalassemia would have iron overload, no? So are there any other way to lower your iron levels without doing what we call bloodletting sila to release more iron, no? So actually, um, because because of your thalassemia, yung, yung error of making your hemoglobin, tawag natin, red blood cells. So madaling masira. So your body is trying to recycle the abnormal, no, or defective uh, red blood cells. So kaya nagkakaroon tayo ng iron overload. Are there any other way to manage this? You can take, there are what we call herbal tawag natin chelators, which chelate iron, but they're not as powerful as actual chelators, no? But you can try taking cilantro because this is a very good uh, chelator. You can use alpha lipoic acid, also vitamin C. These are weak chelators of iron, no? So that's what I could recommend as opposed to doing bloodletting. Okay. So Mr. Bogart is asking, can you take prophylaxis even though meron silang Parkinson? Okay, and macular hole. Yes. So the only again for those who are not aware, no, so ivermectin is not is contraindicated in patients with cirrhosis, liver cirrhosis, no? Okay. May masasuggest from Mateo, parang ang daming may thalassemia. Well, anong diet meal plan for thalassemic patients? Of course, for thalassemic patients, we really have to avoid too much meat kasi iron. So that's what we really have to do. Okay? For Miss Isa Garcia, uh, she's asking for a prescription, no? Actually, uh, Miss Kathy is asking 5,000 milligrams of vitamin C once a month is okay? No. Vitamin C, 5,000. If you take vitamin C of 5,000, the next day you won't have your vitamin C level will drop back to normal. So should be maybe it's not once a month. Maybe you're thinking about once a day. Once a day is fine. It's okay. So LJ Pablante is asking if the COVID case starts out as severe at the onset. Uh, this start as I don't know the question. Malabo yung question ni LJ. Maybe he's asking, can a person with severe at the outset will become mild or moderate and develop as severe? The question is a bit strange. So, sorry, LJ, I do not understand the question. From Sin Chan, are there instances that one can take IVM prophylaxis and still get infected? Of course, no drug is 100%. Okay, the most important thing when you're going to take ivermectin as prophylaxis, you have to take in your body weight based on body weight. Okay, so that's very very important. There's no drug or devices that will give you 100% protection from COVID. Okay, so does not mean that you're taking ivermectin prophylaxis. That doesn't mean that you should be careless in how you should protect yourself. Okay, so does garlic oil have quercetin? It might, but it's not as much because ivermectin, I mean quercetin, garlic oil. She's asking, does garlic oil have quercetin? It might, but not so much because quercetin is not fat soluble, no? So as compared to garlic oil, it's an oil, so it's fat based, no? Okay, Miss Elaine Serrano, they have COVID patients cannot sleep. What to do pag walang melatonin? Okay, very good question. So if you have COVID positive patients or family and friends who cannot sleep, kasi wala ring, and again, di sila makatulog. It's not because they have lack in melatonin. Rather, number one, because they're number one uncomfortable. Number two, maybe because they're coughing a lot. So that's why they cannot sleep. So I would suggest if you don't have melatonin available, you cannot sleep. You might take some antihistamine, like diphenhydramine or something like yung mga antitussives natin, no? Like dextromethorphan. This will help also in calming the cough, no? So you can sleep better. Okay? So does garlic oil have quercetin? It might, but it's not as much because ivermectin, I mean quercetin, garlic oil. She's asking, does garlic oil have quercetin? It might, but not so much because quercetin is not fat soluble, no? So as compared to garlic oil, it's an oil, so it's fat based, no? Okay, Miss Elaine Serrano, they have COVID patients cannot sleep. What to do pag walang melatonin? Okay, very good question. So if you have COVID positive patients or family and friends who cannot sleep, kasi wala ring, and again, di sila makatulog. It's not because they have lack in melatonin. Rather, number one, because they're number one uncomfortable. Number two, maybe because they're coughing a lot. So that's why they cannot sleep. So I would suggest if you don't have melatonin available, you cannot sleep. You might take some antihistamine, like diphenhydramine or something like yung mga antitussives natin, no? Like dextromethorphan. This will help also in calming the cough, no? So you can sleep better. Okay? So does garlic oil have quercetin? It might, but it's not as much because ivermectin, I mean quercetin, garlic oil. She's asking, does garlic oil have quercetin? It might, but not so much because quercetin is not fat soluble, no? So as compared to garlic oil, it's an oil, so it's fat based, no? Okay, Miss Elaine Serrano, they have COVID patients cannot sleep. What to do pag walang melatonin? Okay, very good question. So if you have COVID positive patients or family and friends who cannot sleep, kasi wala ring, and again, di sila makatulog. It's not because they have lack in melatonin. Rather, number one, because they're number one uncomfortable. Number two, maybe because they're coughing a lot. So that's why they cannot sleep. So I would suggest if you don't have melatonin available, you cannot sleep. You might take some antihistamine, diphenhydramine or something like yung mga antitussives natin, no? Like dextromethorphan. This will help also in calming the cough, no? So you can sleep better. Okay? Miss Geraldine. Hi, Miss. Oh, I miss Geraldine too. I miss you. How are you? After chemo, when can we have IV vitamin C? Oh, you can come anytime after your after your chemotherapy. Wait about a week or so, or 3 to 3 days, you can do your IV vitamin C. So we miss you, Miss Geraldine. Okay. Somebody's asking, will we lose our natural immunity once vaccinated? Okay, this is a hard question to answer. Number one, why? Um, because the vaccines are new. Okay, so we need more data. Okay, so whether or not we lose our natural immunity, if we do really lose our natural immunity after a COVID vaccination, then hindi lang COVID ang issue natin. Then we will be having other bacterial and fungal infection if we really lost our natural immunity. So uh, I, I I don't think we actually lose natural immunity, but rather your natural immunity might be depressed. Okay, because momentarily because of the vaccine. Okay. So how do you get back your natural immunity? Of course, simple. You just make sure that you get your enough sleep, good food, take your supplements to make your immune system strong again. Okay.
Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes.